Hi guys, it's Dr. Ryan with another video review of one of the Step 1 free 120 questions. In this video, we're going to look at Block 2, question number 30. So this question describes a 56-year-old woman who's had 2 years of recurrent UTIs associated with flank pain. A renal ultrasound is done, and it shows left-sided hydronephrosis. And then a T2 weighted MRI is shown. There's an arrow indicating one of the kidneys that has hydronephrosis. And based on this, what they want to know is the left renal collecting system is most likely obstructed at which of the following anatomic locations? And they give us 5 answer choices, which you can read yourselves. Okay, guys, so this woman has recurrent UTIs, and her imaging findings show hydronephrosis. That means there's some obstruction to urinary flow, and that's what's led to her recurrent UTIs. What's cool about this question, what I really like about it, is that most medical students will have never seen a T2 weighted MRI of the abdomen, and you don't have to have seen one of these in order to answer this question. They're basically showing you a T2 weighted MRI of the abdomen. They're telling you which side is abnormal and which side is normal, and they're asking you to apply logic and see if you can figure out where the obstruction in the urinary system must be. So to understand this, I'll make my own little drawing of what you see in the MRI. So first of all, on the patient's right side, we have a kidney which is normal. We know that because they have an arrow telling us the other kidney is the abnormal one. And so on the patient's right side, that normal kidney has a normal ureter going down and connecting to the bladder at the bottom of the image. On the patient's left side, we have a kidney which you can actually see in the image is swollen. Even if you're not used to looking at MRIs, hopefully you can tell that kidney looks very swollen compared to the normal side. But even if you didn't recognize that, they have an arrow pointing to this kidney to let you know it's the hydronephrosis kidney. Connected to that kidney, we have a ureter going down to the bladder. And so if you look at the image, you can see that the ureter on the abnormal side is identical appearing to the ureter on the normal side. This means that the ureter on the patient's left side, the abnormal side, must be normal. This patient has a normal ureter and a swollen kidney. And that means that the obstruction must be right here at the junction between the kidney and the ureter. This is not something you're going to have seen before in first aid or in an Anki card. This is just something you're going to have to figure out on the fly by looking at the image and applying logic, comparing the abnormal side to the normal side. So if you know that, then going back to the answer choices, we can pick out that answer choice D must be the correct answer, the ureteropelvic junction. You have to know this terminology, but the ureteropelvic junction is the name of the anatomic location where the kidney meets the ureter. And that's where the obstruction must be because the kidney is swollen and abnormal, but the ureter is normal. So this must be the site of obstruction. As to the wrong answers, answer choice A is the bladder neck. This is not correct. If the obstruction were at the bladder neck, then the bladder would be swollen, both ureters would be swollen, and there would be bilateral hydronephrosis, not nephrosis on one side. Answer choice B is the mid-ureter. This is not correct. If the mid-ureter were the site of obstruction, then the top half of the ureter on the patient's left side would be swollen and dilated, and the bottom half would be normal. But that's not what we see. The entire ureter is normal. Answer choice C is the renal calyx. This is part of the kidney itself. If the obstruction were here, some of the kidney would be swollen, but not parts of it. But we have an entire swollen kidney, left hydronephrosis, so this is not the best answer. And then finally, answer choice E is the ureterovesicular junction. This is the name for where the ureter meets the bladder. If this were the site of obstruction, then the ureter on the left side would be dilated, but it's not. It's normal. It's identical appearing compared to the right side. So once again, a cool question. There are always going to be questions like this on your USMLE exam. They're going to show you images you haven't seen before. Just be aware that they're not going to expect you to be a radiologist and know exactly what you're looking for. They are going to give you clues like the arrow pointing to the abnormal side in this question. And they're going to expect you to just use basic logic to be able to come up with the answer. And that concludes our video review of the free 120 Block 2 question 30.